Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and today we're going to be talking about ankle problems. So two different things that can usually be causing problems in the ankle. One is going to be joint mobility. So if there's something that's dysfunctional in the way the joint's moving, that can create pain, especially if we're not getting the flexion and extension in the ankle when you walk. That can really start to cause some problems, not only in the ankle, but it can change your gait, which can cause problems in the knee, the hip, and into the low back. The second thing that we're going to be talking about is an ankle sprain, which is where you sprain the ligaments on either side of the ankle. So first things first, we'll talk about the function of the ankle. Most of the motion in the ankle is going to be flexion extension. There is some lateral bending, but most of it is going to be here. Just the reason why you don't want as much lateral bending is because it's going to be easy to sprain those ligaments if you move that too much. So when we're looking at the ankle itself, what happens is the bones of the leg come into the foot, and there's a bone called the talus, which then attaches to basically the leg bones to the foot bones. So what we want to do is we want to make sure that especially the extension of the foot is there, and if there is any kind of dysfunction, that we're able to adjust the bones pretty easily. Okay. We also want to be checking the arch to make sure that there's good support there, because that can create some problems with how the foot is sitting in the ankle joint itself. So the adjustment is really the biggest thing that we can do for any kind of dysfunction with the motion of the joint. When you sprain an ankle, the adjustment isn't going to do as much, because the problem is going to be coming more from inflammation and problems with the ligaments itself. So each side of the ankle has ligaments that hold the joints in place. The one on the medial side, the inside of the ankle, is going to be a lot stronger, and that's why when people roll their ankles, they almost always roll them to the outside, and they sprain this outside of the ankle, because the ligaments that we're dealing with over here are a whole lot smaller and less stable. So what we're going to do is we're going to go into the PT bay, and we're going to talk a little bit about deep tissue laser, and then also our compression boots. That'll be our ways of helping in the office. What you can be doing at home if you do sprain your ankle is, most people have heard of RICE, which is rest, ice, compression, and elevation. So you want to stay off of it. You want to try to rest it as much as you can. You want to ice it. That's usually 10 minutes on, 10 minutes off. And you want to put a damp rag in between the ice and the skin. That allows the cold to penetrate more. And then compression is going to keep that inflammation out. And elevation, you just need to make sure that that the ankle is above where your heart is, so that the blood can keep flowing back and forth. So we're going to go into the PT bay, and we'll check out the deep tissue laser and the compression boots. So whether you're having a joint problem or a sprained ankle, definitely make sure that you're getting it checked out to make sure that there's nothing more serious going on, and also to try to help speed up that process. Most people think that they just need to wait to ride out a sprained ankle or any kind of ankle pain, and really if you come into our office, we're able to speed that process up quite a bit. So if you have any problems, or if you know someone that does, make sure you like the video or share it with someone that could find this informative. And if you have any questions, give us a call at 726-0422, or check us out online at wellnessspringfield.com. Thanks a lot.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.